Hey, Syra.
Hey, how are you?
Good, good. How are you?
I'm doing well. How's everything going on your end?
It's going crazy as usual, right?
Never a dull moment, that's for
Never,
sure.
never a dull moment for sure. But I think we have some exciting news, at least, to share with our viewers from last time. Both of our kids have been vaccinated now, right? Very
That's right.
exciting news. Last time we spoke, we were just waiting for that pediatric dose approval. So it was so exciting. My son actually got his second dose last night. So
Congratulations. So actually, why don't you start by, well, first introducing yourself and then sharing his experience, his first
Oh,
dose and
yes.
second dose and, how he felt. I think it would be great.
Oh, yeah, absolutely. So my name is Dr. Uzma Syed. I'm an infectious diseases physician, chair of the COVID-19 task force at Good Samaritan Hospital, in private practice, a partner at South Shore Infectious Diseases, and just do a lot of different things. I'm a fellow of the Infectious Diseases Society of America and the director of the Antimicrobial Stewardship Center of Excellence. You and I have been working really closely together over the last 2 years, and have grateful to have your friendship as well. And I'll update our viewers. Last time when we spoke, some of you may have joined us. I have a 17-year-old daughter who was 16 when she received her first and her second doses, so she was already fully vaccinated. And then my son is 8. He's turning 9 soon. He was waiting for his vaccine and his dose, and every day he would ask me, when is the kid's vaccine going to be ready? I mean, especially after my daughter got her doses, he really felt left out. And hearing about, COVID and, obviously the anxiety and everything going through the pandemic, I know that that was something that he was really looking forward to feel safe and to really get back to some sense of normalcy. So we were thrilled when the vaccines were proven to be safe and effective, and they had been given the authorization and approval by the FDA and by the CDC. So about 3 weeks ago, we went ahead and scheduled his first dose. And I was hoping that we could get it at his pediatrician's office, but they were still in the works of getting the vaccine set up, and they didn't really have a date or an answer for us. So I said, obviously, these things take time. In the meantime, a lot of our local pharmacies, as you're aware, were, having the vaccines readily available. And we were lucky enough to find an appointment at a site that was fairly close to our house in Long Island. So we prepared for it. I scheduled his vaccine appointment, and we prepared for it. We talked about the whole process. He was already aware of a lot of things because both his parents had been vaccinated, and then his sister was vaccinated, grandparents, like everybody in the family. And he hears about COVID and vaccines all the time. So he had heard plenty about it. And we were just discussing, how the day was going to be, how it was going to be. He was just curious how the vaccine was going to be at the pharmacy. He did come, I think, for one of our vaccine, our boosters. He was there in the car, so he saw that that booster was being done at the pharmacy. So he knew that the vaccine could be given there, but he's obviously used to getting his doses at his pediatrician's office. And he had just recently, before that, gotten his flu vaccine. So he just assumed that it was going to be there. So we talked through it that he was going to go in the back. There was going to be a special section where the pharmacist was going to come and explain to him about the shot and give him the shot, and that I would be there with him the whole time, and it would be just like any other vaccine, but it would go very quickly, and he'd be comfortable, and this whole thing. And so after talking through it, we walked in, sat down, and the pharmacist was so kind. I mean, I have to say it was really a very pleasant experience. And I know how busy it can be for them. I mean, obviously, being in the healthcare field, we know how we're kind of pulled in a million different directions, and even pharmacists are so busy with everything that they've been given at this point, and now an additional task of vaccinations, and especially with the COVID-19 vaccines and with children, obviously it's a whole other level. But he was so patient. He came over with his bucket of all his, the vaccine supplies, and then a bucket of goodies. And so he knelt down to my son's eye level and asked him his name, asked him his age, and then he was wearing a Batman shirt, and he asked him who's his favorite superhero, and really was very kind and warm and welcoming. And they had this whole conversation, and then he explained to him what he was going to do and how it was going to be just like the flu shot. And the vaccine took like 2 seconds and it was over. And he was really brave. My son, he didn't even wince. I mean, I think like I probably wince more than him with with any vaccine. So I was really proud of him. And then, he got his, little toy afterwards and a sticker, and he got his card, and he was so excited to get his vaccination card. I couldn't believe it. So I took a picture of him. We were very proud and very happy. And he wanted me to send him that picture because he said he wanted to make his profile picture that picture of him with the vaccination.
Oh my gosh, that's so cute.
It was so adorable. So it was really, I was really happy. And luckily no side effects, nothing. I mean, we had talked about that too. I had explained to him that you might feel a little achy, you might feel, a little run down. If you do, we'll give you some Motrin, you'll be okay. And nothing, with the first dose. He got the second dose yesterday. He already knew what to expect and everything. And he was fine last night. Today, later this evening, he had a little bit of a headache, just felt a little rundown, nothing major. We hydrated, we took some, over-the-counter medications, and within like half hour, he's feeling fine. So far, so good. Alhamdulillah.
I'm so glad to hear that. That's amazing. Yeah. My two boys got their first dose, a couple of weeks ago. I think it was about a week or two ago now. Can't even keep track of time. Time is flying. It definitely does, but no, they did really well. It's one of those, we had to go to the pharmacy too. In fact, my pediatrician's office just called me the other day because we were on the wait list, and they said, oh, we have the vaccine available. I'm like, yeah, well, they already got their COVID, their first dose at the pharmacy. But I think really that probably goes to show you that there's still a lot of pediatrician offices that are starting to get their supply, and they're not now contacting parents, let them know that it's available. Obviously, local pharmacies, have the supply depending on where you are. And hopefully that means that we'll see an increased number of vaccination rates in the coming weeks for all children. And it's really, really important, obviously, now more than ever as we're looking at the data. Do you want to maybe, I guess, first share some of the data on the new infection rates with the pediatric population?
Yeah, so I mean, obviously we have seen since our summer surges with Delta, unlike any of the other variants, there's been significant rise in pediatric COVID-19 cases. And it has been alarming because obviously we don't want children to be affected by any disease. And this one especially when, we have seen so much unfortunate, disease, disability, and death from it. And we don't have that magic bullet still. So, this is something that was really concerning. And for the most part, kids were doing okay. And not really affected that much, or at least we weren't surveying kids to see if they were, asymptomatic. We weren't going around testing kids. And then things were very different in 2020. Everything was in lockdown, and, it was a different sort of dynamics. So through the summer, as we went into kind of some sense of normalcy, and then Delta started surging, we started seeing kids being affected more and more. Schools reopened, all the socialization started, and, people were sort of lax with their restrictions because, again, people have pandemic fatigue. They're tired. They don't want to wear a mask anymore. And that kind of scenario. And so we did see, the rise in cases and our surges with Delta. And unfortunately, more children were really affected. And we really saw a significant amount of hospitalizations for children, which was really disheartening to see, so many children even lost their lives to this disease. And that was really something that is completely preventable at this point, especially with the vaccines being approved up until this point for ages 12 and up, but we still found that the vaccination rates in those age groups was still not that high. And then now we have obviously the vaccines for, the 5 to 11-year-old, and we're really hoping that will really boost. But, in the first few weeks of the vaccine being available, we saw, how many, we have like 28 million children that were available, that were now able to get the vaccine, eligible to get the vaccine in the 5 to 11-year-old. And I think we saw like 1 million in the first week, and we're up to almost 5 million now, which is great, but we still have a ways to go. And I think that's the main thing, is that we've seen this with Delta. We can't really say that kids are immune to this, that they're not going to be affected. And even the most important thing I like to tell parents, especially, and a lot of patients and community members and friends and family that are teenagers, that are college students that I speak to, that have had firsthand, unfortunate COVID infections. People are dealing with long COVID, even when their infections are mild, even when they're asymptomatic. Children, I know so many children that cannot concentrate in school. They can't go to school. Their lives are completely disrupted. Now, this is something that we just cannot fathom for an innocent child. You know, we need them to thrive. We need them to be active. You know, I've got, you know, teen kids that can't participate in their sports anymore. You know, the cardiomyopathy, you know, people always talk about that. COVID-19, the virus itself gives you cardiomyopathy that's often not reversible. You know, there's so many cardiac conditions that this virus causes, and respiratory conditions and lung conditions and long-term neurologic complications that we are still learning about. And you know, we don't know what the future holds. You know, we don't know how long these symptoms are going to last, and they're really debilitating. And some people, some children especially, are really suffering. So I think that's the thing that's really important, especially now with the Omicron variant, you know, that, you know, we are now going to be talking about. You know, we already had experience with Delta, and we've seen how much more it's affected kids. And I think this is the time we really have to, you know, just push forward aggressively with vaccinations, because we have to protect. We have a narrow window now to really protect people, adults and children. And we have to use all the tools that we have right now.
Yeah, I 100% agree. So I think that's a great segue into, obviously, the new variant that is top of mind for everybody. It's obviously making a lot of headlines, and you know, here in the United States, we have the first detected case in California. CDC is mentioning that there's multiple other cases under investigation in multiple other jurisdictions, but it's no surprise. We know obviously it was going to happen here. It was inevitable, just a matter of time that we would start detecting cases. Obviously, there's a lot of key questions that remain unknown. We're still waiting on laboratory data, as well as how it's going to play out in the real world. So, you know, I know some of the top questions everybody keeps asking us in the media, you know, is it more transmissible? Is it more severe? Is it going to evade or erode our vaccine-induced immunity, or any, you know, infection-induced immunity? Those are some really key questions, and even diagnostic-wise. So, do you want to give a, you know, an update on, you know, what we know so far, and then I can kind of provide some of the data as well?
Yeah, absolutely. So those are excellent questions. I think I have been receiving pretty much the same questions. You know, are the vaccines going to be effective? Are, you know, people going to have more severe symptoms? You know, what is going to be the spectrum of this disease? You know, people have all of the same questions, which are great, great questions. And these are the questions that the scientists around the world are trying to answer right now as we speak. So, you know, we're obviously keeping an eye on what's happening globally. We know that over 20 countries have already detected this variant, which is not surprising that it was detected here. That's not surprising either. We are in a global situation right now where, unless the entire world was in a lockdown situation from, I'm talking not now, but from weeks and months ago, then only then would you expect that maybe this is something that, you know, can be somewhat, you know, limited. But, you know, we're not in that kind of scenario, and we haven't been in that scenario for 2 years now. So the answers that we're looking for, that we need answered in the next few weeks, that are going to be very important, is, you know, how transmissible is this variant? Now, people may have heard that this variant actually has a lot of mutations, which is why, you know, everybody's on high alert about this new variant, because it has over 30 mutations in the spike protein. It has over 50 mutations, and some, you know, in the receptor binding domain, and, you know, some different areas and different mutations that actually some of the previous variants had as well, such as the alpha variant, which was the B117, the gamma and the lambda variant, and, you know, and the beta variant had some of these as well. And, you know, some of those mutations that this variant shares with those other variants does make it more suspicious that it will likely be more transmissible. And that's what we're waiting to hear specifically about. And given the fact that there are, you know, significant cases worldwide, again, we are going to, the more we look for it, the more we sequence this, we are going to find it. So we know that there's so much virus out there in the world, even in our nation, but especially, you know, throughout the world, that, you know, the cases have been rising in certain parts of the world pretty drastically. And some of that even in the US, and some of that has to do with the seasonal change and moving more indoors and the holidays and travel. But we can see that there's differences in the trajectory of the incline in the cases in different parts of the world. South Africa, for example, which is why they were really alerted to look for this, you know, steep incline in cases. So that's what we're looking to answer, which most likely, you know, that's what we're thinking, is that this will be more transmissible. Does that necessarily mean that this will be more severe? That's something that we can't just say, just because it's more transmissible, that it will be more severe disease. We heard this before with Delta. We heard this before with Alpha. We were all concerned that, okay, if it's more transmissible, does that mean that the outcome will be worse? Well, on one hand, if you have a variant that's transmitted much easier, that means you have more disease in the community. And that means people who are more susceptible to severe disease can end up being hospitalized. So, in an indirect way, you do have more severe outcomes because more people are infected. So how to prevent that? Vaccinate people, prevent people from being host, and let them really get that protection. And then the next two questions that we have to answer is, are our current vaccines going to be effective against this variant? And that's a really important question that all the manufacturers right now of these vaccines globally are working around the clock to have that answer. We should have that answer in about 2 weeks. And there's a lot of mixed messaging and a lot of mixed information out there. I think this is also creating a lot of anxiety with people. To be honest, we don't have an answer yet, and it's really it's really too early to just jump to a certain conclusion. We have to let the science play out. We have to really see, what is the data? What are we seeing? I mean, that's the reason why the scientists are really working on this, to see, is it effective or not? What we think is that, there is, a good possibility that these vaccines that we have currently may be less effective, because that's exactly what we've seen with all of our variants, right? All the data that we have from the beginning that was done on our wild type virus showed that, it was 95% effective. And then Alpha came along and we knew that the efficacy dropped down. Then Delta came around, the efficacy dropped down even more. But did the vaccine stop working? No, they still held up. They did really well. They still kept people out of the hospital. They still saved lives. So, I think that these vaccines are still going to be effective. It's just a matter of what degree of protection are we going to have, with these current vaccines. So that's going to be a really important question that needs answered. And that's why the whole booster conversation is happening, to really boost the immune response, to really have the most adequate levels, and, really prime that immune response to have the highest levels of immunity, so that you can overcome some of these mutations and really have adequate protection against this variant and any other virus, variant that's essentially circulating. And then, the therapeutics that we have right now, are they going to be effective or not? There is some concern about the monoclonal antibodies, possibly taking a hit, and that obviously we're going to have answers on that as well. There may be one antibody that's more effective than another, but again, we have to remember that science, has advanced so much that we have ways of, tweaking things and modifying things, and having a new antibody cocktail and having a new vaccine, that's specifically targeted towards a variant. So, there are solutions that we can come up with, but what we have to do right now is focus on what we know now, how we can protect ourselves to get through this stretch until we have the answers.
Yeah, that's really great. And thank you so much for, I think, hitting on all of those different points. I think if we were to just quickly go back and talk about, transmissibility, one of the key questions, what do we have in terms of information right now? And certainly there is speculation. I think just very clearly the information we have is very early, it's speculative, it's anecdotal, so it doesn't necessarily mean it's going to actually play out in real world in this way. But right now, as we look at transmissibility and we compare it, for example, to the wild type virus that we had first seen, just in terms of R0s, if one person gets infected, how many more people can that one person infect? So with the wild type, we were seeing about 2 to 3. With the Delta, we realized that that was much more transmissible, given the mutations that it had on the spike protein, and you're able to infect 5 to 8 people. Now with the Omicron variant, there is speculation that it's even more transmissible than Delta. It's unclear how many. There are some mathematical models that are projecting, some numbers that I won't really mention, because again, they're mathematical models and they may not play out in reality. But right now, some of the data that we have, and again, the sample size is so low, if we're looking at just the exponential growth that's happening, for example, in South Africa, you are seeing significant rises of the of this variant. But what we're also seeing, for example, from the passenger from Hong Kong, was the viral load was quite significant, which shows in your nasal cavities you're having a lot of viruses being shed. And then the flight from Netherlands, where you're seeing a good proportion of the passengers did come positive for this variant. So basically, it's showing with this very limited amount of data that we have, is that it seems to be, more transmissible. Now, how is that going to play out in the real world? Is it going to overcome Delta? Again, that's a big question. And then just how transmissible is this variant? And so if you've been following up with the World Health Organization's update on a daily basis, they had mentioned that at least information on the transmissibility of this variant will probably come, within the next few days or so. We'll have a bit more of a clear picture. But in terms of, severe illness, that's going to take some time. There's a reason for that. So if we think that this variant just started, for example, and not before, then we know that hospitalizations and death are a lagging indicator by 3 to 4 weeks. And so we'll probably won't have that data until another 2 to 3 to 4 weeks to see, is it truly causing severe illness? And it's not about the number of mutations that this variant has, it's the quality of the mutations and what is it going to actually play out, phenotypic wise, and things like that. So I think there's more information to come on that. And I think based on what the reports and the small sample size that, we have, it is showing a very wide spectrum. You're seeing mild illness, you're seeing moderate illness, you're also seeing severe illness. It's really hard to pinpoint, one way or the other. So I think from that perspective, again, we need to have much more and better data to show that. I think in terms of, vaccine escape, and I don't really necessarily like that term. I know media is using a lot of that, but I think it's really important to emphasize that, the current COVID-19 vaccines, and as you've also, mentioned, Uzma, is that, our previous variants very similarly, held up very well to our current COVID-19 vaccines. And yes, vaccine effectiveness did, basically take a couple of punches here and there, but they're still highly effective in terms of severe illness and death. And I, for one, believe it's going to be the same for this particular variant as well, that our vaccines will hold up for a couple of different reasons. First, the vaccines generate a polyclonal response. It's not just one type of antibody, it's a broad range of antibodies. And then now with the booster shots, now, as you know, the CDC made a recommendation not that, everybody should get the COVID-19 vaccines. Everybody, not may, but now should get the COVID-19 booster dose. And so there's a reason for that. Do you want to maybe get into a little bit about why booster shots are being much more, highly recommended or more universal in terms of its recommendation?
Yeah, I think, we've gone back and forth on this pendulum for a while now, and it was very touchy because, again, we are still somewhat in a vacuum here if you look at the global scale of the pandemic, and there is still significant vaccine inequity throughout the world. And the U.S. has done a good job of donating, vaccines globally, but really there still needs to be so much more, and has to be a global effort. Like, everybody needs to step in, and there has to be much more of a coordinated effort to really vaccinate, because again, the more virus that's out there, you're going to see these variants keep emerging. And I think so the main thing is, initially the recommendation was for immunocompromised people, and we saw that booster recommendation came out fairly early. First before the general booster recommendation came out, and then it came out for the elderly. We have data that showed waning immune response, especially for those in a certain age group, elderly, and those who are immunocompromised, as I said. And so then those boosters were recommended. And then it was high risk exposure, looking at individual circumstances, are you going to be more susceptible because, you're a healthcare worker, you're a teacher dealing with children who are unvaccinated. And, we do know that children still carry a good amount of virus, even if they're asymptomatic, and they can keep transmitting. So, those kind of scenarios, it was, acceptable and recommended that people get boosted. Now with the new variant, obviously our numbers are going up nationally and globally, but, we have seen significant rising cases nationally. We're averaging, over 80 to 100,000 cases, and we're seeing tremendous amount of hospitalizations and deaths. And we can see that this is just, we're just coming off of Thanksgiving. So we still have Christmas and New Year, and, there's obviously significant travel and gatherings, and people are going to be indoors because of the change in weather. So we're already kind of going in an upward trend after we have plateaued off of our, summer surge. And so it's a little concerning that going in an upward trend before, this new variant really takes hold in our communities, it's not in a good place where we want to be right now. So how can we, really protect ourselves in the best way and be the most prepared for this variant, because we know it's just a matter of time. This is going to happen. It is, we think that this, has potential to really be more dominant. We don't know. We'll see. Sometimes beta, did not propagate the way we thought it would. But there's still plenty of delta, worldwide, and especially in our communities. So there's still plenty of virus there, bottom line. And if you have another transmissible variant that's out there, how can we protect people the best way so that we can save lives, and really continue to get through a very difficult time? Because this winter time, if we go back just last year, how difficult of a scenario that winter surge was for us. And then just what's happening nationally, there are lots of hospitals that were, still operating in crisis level care across the country. Once the South started cooling off, we saw the mountain states really surging, and, they were in crisis level care, and the hospitals were full, the ICUs were full, all the surgeries were canceled, elective surgeries. I mean, that's not the kind of scenario you want to be in. That's really not good practices for anyone. I mean, when you have an emergency, you want to be able to access healthcare in a timely fashion for anything else, not just COVID. And so that's really, the recommendation right now is how can we best prepare ourselves besides all the tools that we have. And I think that's the thing people need to remember, that vaccination is definitely the prime thing. The point that we want to get at is if you're not vaccinated yet, you really need to get vaccinated ASAP. Do not wait. If you're vaccinated, you should get boosted. If you're a child, you have a child that's, not vaccinated, get them vaccinated as soon as possible. This is, we really need to be very aggressive with this. But also remember, you may have relaxed a lot of your mitigation strategies before. You may have said, oh, it's okay. I don't need to wear a mask anymore. I'm going to hang out in large crowds. I'm going to go, go to a party, go to a bar, whatever. And, I think now you have to remember that things are different now, than they were maybe in the summer. You're not outdoors as much. The positivity rate is climbing everywhere, Long Island, it's been going up significantly. So these are things you have to remember. So you have to remember the masks, first and foremost. You have to think about, what kind of environment you're in. You have to think about ventilation. You have to think about testing. We have all of these things now. Masks are not an issue. It's easily available. Testing is not, nearly the issue it was, 2 years ago. Certainly even last year, we had a hard time getting tests. So, we've come a long way. So use all these tools. That's the main thing. We have all of these great, resources that we have access to, where people in other countries may not even have the luxury of having access to a mask or a vaccine, even if they're frontline healthcare worker, or a test. So these are things that we have to remember, that we are privileged. We have access to these things. Let's use them to the best of our ability.
So you had some really important points, and I think the analogy that I'd like to share is, first, everything you've laid out are various risk reduction measures, right? So we know that we may not be able to get it down to exactly zero, but we can get it down very close where we have very minimal risk. And so that's obviously with making sure that you're vaccinated, if you're eligible for the booster, going ahead and get that booster dose, making sure you're wearing a mask in indoor spaces when around others, and, mixed gatherings, things like that, good ventilation, testing. So all of those are risk reduction measures. And it's very similar. So when you go and drive a car and you want to go to one place, you want to wear a seatbelt, but on top of that seatbelt, you also want an airbag, in your car. So God forbid you get in a car accident and you only have that seatbelt on, you also have that airbag, right? Gives you that 2-layer of protection. So think of these risk reduction measures that Uzma just shared with you in terms of testing, in terms of masking and vaccination, as those risk reduction measures, because it's one thing that's going to add up on top of the other, and it's going to help protect you. Yes, we all want to have all those things in our car, right? Because we want to be as safe as possible, even though the likelihood of us maybe getting in a car crash may be minimal. It's not zero, but it's minimal. Very similarly, we want to reduce our risk as much as possible. Now, in the middle of a surge where infection rates are so high, in 80% of the United States, you're seeing, pretty high to substantial community transmission. That means there's a lot of virus circulating in our community. So now it becomes even more important that we apply these risk reduction measures for ourselves, as well as for, our kids, our family, our community, make sure we don't obviously spread the virus as well. So really, really important information. And I think it also gets to the point of there's so much fear and anxiety with this new, Omicron variant and what this means. But it's also the so what question, right? And what I mean by that is, if we do find out that this variant is in fact more transmissible, so what? What does that do? How does that change our behavior? How does that change our public health policy? What do I have to do differently at the individual level? Similarly, if we find out that it causes more severe illness, again, so what? What does it do? How do I change my behavior? How do I protect myself? Or if it does, have any type of impact on my vaccine, induced immunity, what does that mean? So I think it all goes down to the tools that we have in the toolbox. And I think everything that you have just laid out and the so what example that I gave you, that I gave everybody, really goes to show that we still have the tools to combat even this variant that we're facing. So yes, if it does turn out to be more transmissible, we can always wear a high quality mask, right? Because these variants don't defy the laws of physics. They're not going to go through your mask in that sense if you're wearing a high quality mask. Our mask will continue to work, so we can wear a high quality mask in those high risk situations like indoor gatherings. If we know that it's going to cause more severe illness, the best way to protect ourselves from severe illness and death is to get vaccinated. And very similarly with, any impact it has to our vaccine-induced immunity, there's booster doses, right? And that's where even these pharmaceutical companies have a plan B in case that it does have a substantial impact on our vaccine. Pfizer came out and said that within 100 days, we're able to develop, manufacture, and, basically send off newer versions of the COVID-19 vaccine. I wouldn't wait for it. I would want to make sure, obviously, that this is what's happening right now. We don't know whether, these newer versions of newer generations of the vaccine would be available. So certainly get, your booster dose right now if you're eligible for it. And obviously more information is going to come. But I think we have our pandemic toolbox. We know these tried and true measures work. It's what's going to keep us safe. From a public health policy standpoint, I think that's where we'll have to adjust, right? So depending on, what we learn, if it is truly very transmissible, then maybe, for example, if you're in New York, they may reinstate indoor masking at all times, right? So these are some public health policy changes that we may see depending on what we learn. And again, and science does take time, so we'll learn some of this information in the coming days to weeks. But at least right now, we have the tools at our disposal. So one question for you: are you changing any of your behaviors? Given obviously all of this new information, is there anything that you're doing differently that you would recommend to the viewers?
Yeah, I think this is a great question. So everyone's comfort level is a little bit different. Obviously, being on the front lines, for 2 years and seeing the unfortunate amount of death from this horrible, horrible disease, I tend to be, more cautious. I'm not the one that's really a risk taker. So I usually am more on the cautious side. But I have a lot of colleagues that are more relaxed. But, I definitely, based on the seasons and the timing and what's happening, with this global pandemic, you see when you can, relax a little bit and when you need to really be a little bit more vigilant. So I see, for example, now, people are out shopping, it's the holiday time. Everybody's, the malls are crowded, there's, everyone's trying to get their holiday shopping done and people are traveling, So, I'm going to make sure that I limit my time, in these crowded scenarios, or that I'm definitely wearing, I may not be wearing my surgical mask. I will definitely be wearing my KN95, when I know I'm going to be, on a line for an extended amount of time with people who, especially if people are unmasked around me, as you're aware, in Long Island, we don't have the indoor mask mandate at this point. So, a lot of places in the country, it's very different. There's not a centralized approach. So for me to feel safe, and especially with the amount of virus that we have circulating, I mean, these are the things that I think about when I'm meeting with friends. You have to think like, okay, it's a little bit different now that there's so much more community transmission than it was several months ago. So you have to really think about, the people that you're meeting with and who are they meeting with and who are the other people that they're coming into contact with and how much risk is there with, meeting with people. And you just try to find a safer environment, and you try to, like I said, make sure everybody's vaccinated, make sure everyone's feeling well, and that you have your masks, So those are the things that, I'm just being cautious with the mixing of crowds and mixing of people, and especially with, travel and things like that. Just, and the main thing that I have been doing a lot of is testing. And that's been like the most, I would say, the thing that has given me the most peace of mind, because obviously we just came from Thanksgiving. And for anybody who follows me, you may have seen, I still have to share my recipes, actually. I hosted Thanksgiving. Yeah, I just realized that I posted that I was going to share my recipes and I forgot to do that. But I hosted Thanksgiving this year, and I was so happy because I was actually off and not working, and I was able to host after a long time. And it was so nice to have that family gathering again. But we had mixing of a couple of households. households. So what I did, and even though everybody was fully vaccinated, but we had a few children, including my son, who was not fully vaccinated yet. And so I said, we're going to make sure that this is a safe gathering. Not only did I make sure that everybody essentially all the adults were vaccinated, and I knew essentially what kind of households and environments people were coming from, but, I made sure that everybody was also tested before the gathering. And I had, the windows cracked open a little bit just in case, so it makes it a very ideal kind of environment, a safer environment, and you feel comfortable. So everybody has a good time. You don't have to worry. And, you can kind of go on. Like, life can still go on. We have things that we can do. We're not in a place of 2020 where the world just came to a halt, right? We can still carry on in a safe manner, but use these things because you don't want to have regrets. You don't want to have regrets that, you weren't careful and you could have been careful. And nobody's telling you that you can't live life anymore, that you should be locked up in your house. You can certainly still go about your routine. Just think about things, and just know when you have to pull things in a little bit and when you can relax them a little bit more. And that's what this whole thing is about: watching what's happening in your community, watching what's happening in the globe. And the one thing I want to say, also I wanted to add that, with people hearing about cases from South Africa, that, there's a lot of, in the news about how most of the cases are mild, and, we still don't know. It is still very early. So that's the other thing why I want people to have this urgency in getting vaccinated, because things could be very different in several weeks from now. Right now the virus seems to be transmitting, and it's being picked up obviously in a lot of people who are younger, a lot of college students, and so generally younger people will have more milder symptoms, and that's great. But the people that are being hospitalized again globally are again mostly unvaccinated people. So that's again something that we have to watch out for, and also know that the more immunocompromised elderly, the people with just any underlying medical condition, whether it's, a heart condition or high blood pressure or diabetes, metabolic syndrome, whatever it may be, you may think that you're fine, all you have is diabetes, and that's a significant risk factor, even if you're young. So anybody that has these conditions, we usually see that trend where these people get affected, a little bit later, and then you start seeing, as you mentioned before, there's a lag in hospitalizations, there's a lag in deaths. So we don't want to just put everything, all our eggs in one basket, and just put everything on just the little snippets of what we're hearing so far. Oh, so far the cases are mild. So far people had no symptoms. Well, again, we have to remember there's a lot of nuances. Some of the people that were tested were asymptomatic, and they were tested for travel reasons, and they were already fully vaccinated. There's different types of, there's a whole spectrum. So we can't just assume that, oh, if they're asymptomatic, that means nobody's really going to get sick from this. Like you said, it's too early to know. But I think the thing to focus on is that we know that less than 20% of adults have gotten their booster at this point. I have lots of patients, the cases are going up a lot in our hospitals as well. I've seen a big difference in just 2 weeks time frame, and this is going to continue to happen. But I am seeing more breakthrough cases, and a lot of these people have not been boosted yet. And a lot of these people think that they're not eligible, or they think that there's no need for this booster. And so I think that's the really important thing, because a lot of the patients that I have now are elderly, are those people with underlying medical conditions, or even, younger people with underlying medical conditions, and they were eligible for the booster, but they chose not to get it. And I think that's the thing that we have to be aware of. And then obviously the children, as we spoke about before, because there's still, a small fraction of them, that have started to get vaccinated. We have to push forward with that.
Yeah. I think that's really, really great to highlight. And I think just on a personal level, while I'm fully vaccinated, I also got infected last year, April of 2020. And looking at some of the, research and the reports, I decided, I'm not going to get the booster because I got naturally, infected, and then I got fully vaccinated. Now with the new variants and then seeing all the new reports now coming out, obviously very preliminarily, I am planning on getting my booster, even though obviously I was also naturally infected, last year. So I think as we look at some of the data, and these are some of the questions that came through, and we got a lot of questions that came through when we asked questions, and I think we answered quite a bit of them as we were discussing. But one of the questions was, what's the rate of, for example, reinfection if you have infection-induced immunity? And so it's getting more to, this person never got vaccinated at all. What is the rate of reinfection? So we know with Delta, obviously, We know what that looks like. We're not exactly sure with the Omicron variant and what that may look like. There obviously is anecdotal reports and speculation that it is even higher in terms of reinfection. And it just goes to stress that we need to make sure that anybody is eligible to get vaccinated, which is everybody over the age of 5, is to get vaccinated. So really, really important. So I'm going to go through some of the questions that we received and the ones that we haven't answered yet. So the first one, and I think, this is covered quite extensively now, but, why was, South Africa put on the red list for what they call, so this question is for discovering the variant. And obviously they detected the variant, not necessarily being the original site of where this, variant originated. But what are your thoughts on, I guess it's getting to the question of the travel ban and the restrictions?
Yeah, no, that's a great question. And, it's so challenging because we've been through this for 2 years now, and we know that these travel bans don't really work. We've done them before. And like I said in the beginning, that unless the entire world shuts down or you're restricting travel from everywhere, we know in New York, our first cases were not from China, even though, the ban at that time was from China, but we knew we were getting, our cases were from Europe. And even if you look at from, from a diagnostic perspective, I couldn't even order a test on anybody unless they had recent travel from China. So it just shows you how, our thinking is so much in a bubble, in a vacuum. We're still very much global. This is why we all say we're all in this together, because, there are so many moving parts. So the thing with the bans, it's unfortunate. We've seen this before with the Alpha when it was first, described in the UK, Delta with India. By the time this policy goes into place, and again, I don't want to get into politics, but I'm just saying that by the time the policy goes into place and when the variant is first reported, it's usually already widespread. When you look for it, you will find it. And we know with the global scale and, the globalization of the world that we live in, that that's really the case. So I think, we have better ways, more effective ways of trying to, really deal and use the tools that we have nationally and globally. And we already know that, we've already heard from other countries in Europe that they found samples from patients that actually predate, the variant that was first described in South Africa. So we already know that that's not where it was, they reported it first, but that's not where it emerged from. So,
Right.
so in that respect, I think we need to focus on other things aside from travel bans. I know people do it for different reasons. Like I said, I'm not going to get into it, and there's a lot of play into buying some time. But I think we have a lot more information now than we did before. I think if the whole world really focused on ramping up genomic sequencing and surveillance, and we had better approaches on that, and we had better results, better playbook for how we deal with new variants, I think we'd be in a better situation.
Yeah, absolutely. Absolutely. So another question we received is, should those that are pregnant receive a booster dose? And obviously we know that that's a very high risk category. And there's a lot of, cases and hospitalization that we've seen. Do you want to speak a little bit to why it's so important to get a booster dose?
Absolutely. So, I had mentioned this previously as well, but, pregnancy, it's really unfortunate, but I've taken care of far too many pregnant women that have had COVID. It's really, heart-wrenching, and it's just absolutely horrendous to say goodbye to a pregnant woman, or to have her lose her child, and the family. And it's a situation that nobody should be in. These vaccines have been proven to be safe and effective. They are recommended for pregnant women, for any woman of childbearing age. There has been absolutely no correlation with infertility. We have already proved that that's a myth. And, all of the major medical societies recommend vaccination and boosters for all pregnant women, because the risk of severe COVID is so much more in pregnancy. And the pregnant women have higher risk of needing ICU care. They have higher risk of preterm labor and worse outcomes for their babies. And like I said, I have seen this firsthand. So we want to make sure we protect them. So anyone who's pregnant should really get boosted if they're, 6 months out from their mRNA, like Pfizer or Moderna vaccine, or if they're 2 months out, from J&J, but most likely they wouldn't have had that vaccine. But it's definitely, advisable that they use all of the protection that they can, especially as the cases are going up. They need to protect themselves and their baby.
Yeah, absolutely. Thank you for highlighting that really important point. So another question that we received is, when can kids under the age of 5 get the COVID-19 vaccine? And I know that's top of mind. I have one kid that's obviously a year and a half, so she's in that category. And we know that these immunobridging studies are ongoing. COVID-19 vaccine for 6 months to 2 years, and then 2 years to 4 years. Looking at maybe sometime next year in quarter 1. But any information that you want to also provide to the viewers?
No, I think this is, again, just like we were anticipating the 5 to 11, we really, there is this urgency because parents are so concerned for their little ones, and I know that there has been a lot of transparency from FDA, from CDC, and I think that's been great. And I know that they had wanted additional data and they wanted longer set of data just to make sure that the vaccines were safe and effective. And as we know that they had dropped the doses down for the pediatric population. So I don't think it's going to be sooner than what we had hoped for. I think they're going to probably stick with their timeline, and again, they don't like to rush anything because, again, we want to make sure everything is safe and effective. And I think for younger kids, the best thing I always say is make sure you vaccinate the entire household to protect them. That's the best thing that you can do. If you have children that are 5 and up, they should all be vaccinated. That's how you can best protect, your younger ones that are under 5.
That's correct. That's right. Thank you. So I think last question, we had a lot of questions that came in, and I see that there's more questions coming in now, but I think just in the interest of time, one of the questions that we received is, what is the rate of breakthrough infection and how are hospitals preparing? So I think one thing that I'll just, first add, we have obviously information on the Delta variant. We obviously don't have information on the Omicron variant and what breakthrough infections would potentially look like or what the rate is. But I think just also in terms of just hospital capacity, I think hospitals around the nation are bracing for ongoing rising infection levels, case levels, hospitalizations, potentially even, seeing increased levels of death. Mainly, really, I would say in the unvaccinated, in the healthcare system that I'm part of, with the circles that I'm part of from a national healthcare delivery system perspective. I think many are bracing for a number of unvaccinated individuals, potentially obviously getting infected, requiring hospitalization and things like that. So there is obviously surge and flex plans. There's a lot happening in terms of right now preserving hospital capacity should there be a need, and then looking at staffing structures and the like, both at the state level as well as nationally. But do you have anything you would like to add in terms of hospital preparations for surge?
Yeah, I think those are, everything you highlighted there is just spot on. Everyone is really preparing. I think, again, it's hard because, we've seen surging, throughout the nation, but one area, is doing okay. And then, all of a sudden become, a hotspot or cases take off there. And we've seen that throughout this pandemic, but we've all been through it at some point, and I think that's the thing. During this whole pandemic, at any point we can see that these changes happening with increasing transmissibility in the communities and cases rising and positivity rising. As I mentioned, we are having more breakthrough cases. I think partly because, just the timing, when our vaccination efforts started, we are in that window now where the immunity is waning. And because we have so much virus in the community, if the viral levels were low in the community, we'd be in a different position right now. We wouldn't have, if there were less variants and if we had not that much virus in the community the way it was, towards last spring, it would be a different scenario. So for that reason, I think we are seeing more breakthroughs. And again, we have to also remember that how people are defining breakthroughs, because sometimes people, come in for pre-surgical testing, they have a procedure and they're asymptomatic and they test positive, that's very different from somebody who actually has symptoms and actually has disease, so there are different categories of that. So it's hard, to kind of lump that all together. But definitely, I think that there is this anticipation that, things are already, ERs are very full right now. And, centers where they're giving monoclonal antibodies are very, very busy right now. Hospitals are getting, we can see the trend where there's more COVID patients arriving to the hospitals. Like I said, most of them are unvaccinated, but we are seeing more rates of vaccinated people coming into the hospitals. And that's mostly because of, waning immunity. Mostly, again, if you're looking at the elderly population and in nursing homes, I think the stats are, nursing home residents. I think there's over 92,000 or something nursing homes, and their booster rate is only about 50%. So again, you're looking at who's most, susceptible. We did great in our first round of vaccinating the elderly, the residents of long-term care facilities and nursing homes, and we got that really susceptible population vaccinated very quickly, very early on. But I don't think we're being that effective in boosting them. And then the same goes for people, again, that are more susceptible. So I think because of that, there is this fear, and with the timing of the year, the cooler weather, the holidays, the travel, it's the perfect mix for that. And then this looming question about what's going to happen with Omicron. Again, Delta is, still very, much alive and, significant in our communities. So whichever variant it may be, there's still too much COVID around. And that is something that I think the hospitals are really preparing for.
And thank you for highlighting the difference between breakthrough infections, because obviously there's a wide spectrum, right? And so when we look at the current COVID-19 vaccines, they hold up very well in terms of severe illness, severe outcome, and death. But obviously no one wants to also experience a breakthrough infection, because that can also lead to potentially long COVID. Even though your risk of long COVID obviously is slashed even by half or more, you certainly don't want to be put in that position where you want to experience any form of illness and potentially even spreading it early on to loved ones. And that's why getting your booster dose is also really, really important. I think the other thing to also highlight, and particularly here in New York City, if you are looking at the New York State Department of Health website, it actually tells you that for those that are unvaccinated, they have a 6 times likelihood of getting infected versus those that are vaccinated, and have a over 10 times likelihood of being hospitalized versus those that are vaccinated. So it really goes to show you the power of vaccination and why it's so important. This is not obviously about politics or, big pharma. It's really about how can you protect yourself, your loved ones, and those around you, and how we can safely exit this this pandemic, and really, obviously end it for everybody. So thank you so much for joining this evening. I think we went a lot over our time, but there was so much obviously that we wanted to talk about. But thank you so much. Anything that you want to, leave the viewers with as we conclude today's session?
I just want to thank you again, Syra, for all your work and your dedication, and for being really just a superstar out there during this pandemic. I'll just leave everybody with just one final thing, because I think you kind of touched on it already, but it's really tough because the narrative changes a lot in the pandemic because the situation changes. So previously, we did talk, and I spoke to a lot of colleagues even before, and even community members about, just like your scenario, maybe not needing the booster if you've had prior infection, but people have to understand that all of that changes now with a new variant, right? So I think that's something that I really want people to appreciate, that even with prior infection, you don't know, there's so many nuances. How long immunity will you have? We know that vaccination gives you much longer and more robust immunity. And, there's so many nuances with prior infection. How long ago did you have it? How mild was it? How severe was it? All of that. So just keep that in mind as well. And then the last thing is that, people may be wanting to wait because they're hearing a lot about, Pfizer, Moderna, all these manufacturers are working on new vaccines. And I get this question a lot, that they're just going to wait till the new vaccine comes out instead of getting this booster and then maybe having to get that. Well, I just want people to know that, and I think you mentioned this before as well, this is not something that's going to happen overnight. And every day that you wait is, risk of acquiring the infection. And we really want people to be well protected. So the best thing you can do is to not wait, go ahead and get boosted. And we'll have more information, soon, hopefully, on these vaccines and this variant.
Thank you so much. And thank you for everything that you're doing on the front lines for the community, and for being an advocate and providing some really great ongoing science communication on your Instagram pages, on your Twitter. So thank you for everything that you're doing as well. So with that, thanks everybody for joining. We'll post this session. We covered some really great information and a lot of different questions. We had a lot more questions that came in, but we may do another round of this because I think we have another 10 questions that came in that are not necessarily related to the current variant, but just generally asking a number of really great questions that we just couldn't get to tonight. But thank you all so much. And with that, have a good night.
Bye.
Bye.